Good morning. My name is Abdoulie Njie from the Gambia. Brought in here, recommended by the First Lady's Office, working at the EFSTH as a staff nurse. First of all, in our country, there is only one biggest hospital in the whole of Gambia. So which makes it difficult for care to be given, because Gambia is a big country compared to other countries. So our specialty care, first of all, we lack funds, number one, and two is we lack materials for the institute to give care to the patients. So when it comes to the rural area, it is much more difficult because there is number of patient ratio is a bit dull, and mostly equipments are not available. So for nurses to carry out their job is a big difficult. Through my experience in the Gambia, like I said before, there is only one biggest hospital in the Gambia. So when it comes to the rural area, there are little or no doctors that are been put there for oncology. So all the oncology doctors are all based in the biggest hospital, which is Edward Francis Small Teaching Hospital. So in the rural areas, there are little or no nurses that have been placed there for oncology. So the rural area people find it difficult to have a healthcare facility in their place. In my country, the infrastructure there is a bit, sorry to say, but it's a bit poor. So first of all, the nursing patient ratio is like 1:5 ratio. So when it comes to patients that are there are fewer nurses compared to the number of patients that are there. So in my field of studies here, which is oncology, we have little or no, we have fewer doctors and nurses that have these specialty areas on oncology. So which makes it more difficult for the treatment of cases like breast cancer and other cervical cancers. The Merck Foundation program helps us a lot. For me, it helps me through for my own personal development on oncology. Right now, I'm having a broad spectrum on how to go about in caring for cancer people. So my patients too in back home, they will be benefiting a lot from this, as we have seen different technologies, different treatments, and different approaches on how to tackle these cancer treatments. So they're helping a lot. And from my point of view, if this continues like my colleagues, so we will have a better future in development, in tackling cancer cases in my country. For the program, I was expecting a lot. So I was even happy to be part of these people. So as it will help me to learn more cancer cases and how they are treated, how the radiotherapies are done, how the stimulations are done. So I'm really expecting, was really excited and to be experiencing much of this. When I came here, it was a mind-blowing seeing how their treatments are being done. So compared to my country, so it was really, I learned a lot from them. We were, as my field of studies is concerned, I was exposed to chemotherapy, which is how cancer treatment management have been done. Those are part of the cancer treatments. Radiotherapy, the CT scan stimulation, where the diagnosis has been done. Molding, which I have seen for the first time, like making frame of particular areas where the disease cancer is. So I've seen many radiotherapy machines which are of advanced machines which I've never seen before. So I've been to ask oncology is concerned, so we have been also exposed to the ICU areas. We have seen different kind of ventilation machine. We have seen how critical patients have been handled, and the arterial blood gas, the BLS. So it was so educative to see those kind of things for the first time. This training will help me a lot as an individual, as it will boost my knowledge in wide spectrum of cancer diseases and other medical disease conditions, as we have seen new diseases and their diagnosis, so which we have never seen before. So I guess when we go back to our country and see those kind of diseases, I don't think it's going to be a problem in tackling those kind of diseases. So for my country, it will help us a lot, as we will encourage our staffs and our departments to tackle patients with great care. For my colleagues that will be coming in this program, you have nothing to worry about, because you will learn a lot from this program and you will benefit a lot, because there are equipments that are here that you will be seeing for the first time, and you'll be so excited to see how they are being operated. And the medication, you will be finding different kind of medications too that are different from back home. So it will help you a lot in knowing different kind of diseases and the medications that have been used here. So you'll be seeing different kind of ICU machines too for the first time that you have never been operated. So for the first time operating that, it will be so overwhelming. So you have nothing to worry about, because you have been taken care of, and the people here too are so encouraging. So you will be working hard with them too. First of all, I would like to thank Merck Foundation for the great opportunity they have given me. So I guess without them, I wouldn't have been here to attain this wonderful program. And I would like to thank the institution for the steps they have been taking me through, seeing different kind of patients, different kind of machines that have been operated. So I would like to thank them, because they have helped us through a lot. They have been pushing us hard for us to study, and without any delays. And I would like to thank Merck as well, and they really gave me a great opportunity of my life coming here in India to study for oncology. I would like to thank the First Lady's office too. So without them, I guess there will be no collaboration with them, with the Merck Foundations. And I would like to thank them too for giving me the opportunity, for bringing us here. So it will help the Gambia, it will help me a lot, as well as the Gambia, in terms of caring for patients and seeing other kinds of conditions in India too. The Gambia.